GfK Kinetec is a market study firm. We are specialized in animal health and work with various pharmaceutical companies, including Siva, who asked us to conduct a study on compliance. It was a qualitative study, so the results I'm about to present have no statistical value. However, we were able to gain an in-depth understanding of the behavior and the attitude of a number of vets, 8 in France, by looking at the way they work and the way they manage cardiology cases. The vets we surveyed are well known as big prescribers. They are general practitioners, most of them working in suburban areas. They see a normal number of cats and dogs each day, have good business, and are between the ages of 30 and 50. I would describe them as average vets.
30 et 50 ans. Voilà, c'était des vétérinaires habituels, je dirais.
7 out of 8 vets we surveyed want to keep the dog in their clinic as soon as they realize there is a heart problem, in order to be able to run all the tests at their own pace, X-ray, echocardiography, blood tests. Next, and this is an important aspect, they conduct a long consultation with the owner, lasting about 45 minutes, in which they give details of everything there is to explain. They all told us that this was a time they considered to be important, on the one hand to obtain the owner's acceptance, and on the other to aid long-term compliance. So how do they explain the disease to people who are not vets? Vets use certain terms and analogies and do so in an intentionally simplistic manner. They all talk about the development of the disease and the importance of treating it quickly. They have noted that it is not particularly difficult to justify a treatment because they generally prescribe when the first clinical signs appear and not before. One of the conclusions that can be drawn from this is that the key to starting up treatment is the vet, not the customer. Again, regarding the explanation of the disease, all the people we met said, I draw a picture, the simplest possible diagram with a circle, tubes entering the circle and tubes leaving it, and 4 valves. That's what I do, and it works very well. Some, but not all, also use imaging, the X-rays they have done and the echocardiography if there is one. They explain the difference between a healthy heart and the heart of the dog suffering from the disease. We also asked them about their perception of their customers. They put customers into 2 categories. The receptive people, those who will immediately ask questions, talk about food, exercise, life expectancy, etc. And non-receptive people, those who do not seem interested in the explanations and immediately talk about money and the hassle of treatment. They say the dog is old and after all it's only a dog. So that is how they categorize their customers. But at the end of the day, it is the vet who holds the key to the treatment that will be prescribed. The majority of vets suggest the treatment they think is right at the moment when the treatment is to start. Another element that counts is the vet's perception of the customer. It is observed that the fewer preconceptions they have of their customer and the more convinced they are about a product, the likelier they are to prescribe it. The prescription itself also counts for a lot. Vets consider that if the customer does not understand what is written on the prescription, there is very little chance that they will manage to follow the treatment. So they make sure that at the end of the 45-minute consultation mentioned earlier, the customer has perfectly understood what they are supposed to do. Also, during this first consultation, they invite the customer to ask all practical questions which they answer. Next, obviously, the treatment is put in place for the long term. They note that the first month is critical for long-term compliance. Half the respondents are in contact with the owner after 1 month, either by telephone when they consider the consultation will cost too much, or for a new appointment with the animal. They consider it to be vital that the owner sees an improvement in the clinical condition of the dog. For example, they think it's very good if there is less coughing and if the dog has resumed a little activity, as this is a factor of motivation. The other thing which comes into play in long-term compliance is the ease of administration of the treatment. The best drugs are palatable, or at least easy to administer.